This is Lindsay Sullivan back live at Bone and Joint Institute. And today we have Dr. Todd Wurth and Laura Davis, one of our occupational therapists. And today we're talking about some arthritis in the hand, something called CMC Arthritis. And Dr. Wurth, and Laura will go into a little bit more detail. But before we get started, Dr. Wurth, tell me a little bit about yourself, about your specialty.
Yeah, so my subspecialty is predominantly shoulder, elbow, wrist, and hand.
Okay.
So at Bone and Joint, by and large, we all do some degree of general orthopedics and orthopedic call and whatnot, but the majority of us are subspecialty trained, so we have areas of clinical interest that we have additional training in. And so mine is predominantly upper extremity surgery.
Okay, and where are you from, just briefly?
Originally born in Tennessee, grew up in Kentucky.
Okay.
And did my residency at Indiana University. I did medical school at University of Louisville in Kentucky, orthopedic residency at Indiana, and then a year fellowship in Pittsburgh before coming to this, my one and only job.
Awesome.
So.
Well, very nice. And Laura?
I also was born and raised in Middle Tennessee. I began occupational therapy in 2002, and then in 2004 started in just upper extremity occupational therapy, so focusing on orthopedic treatment of shoulder to the hand. I've actually worked with Dr. Wurth here for about almost 18 years, I think. So.
Well, we started together, and I wasn't going to include the year that we started together, but we did, so it's okay.
We'd make it there at some point. So, and we'll talk a little bit later about the teamwork that y'all have in the practice, which really makes just the collaboration and the patient experience great. But we'll kind of hold on that right now. But Dr. Wurth, we're talking about CMC arthritis. So, can you explain what is it, where is it, just briefly?
Yeah, so CMC arthritis it's also known as basal joint arthritis, basilar thumb joint arthritis. And there's a joint at the base of the thumb that's involved with this condition. It's very common. It's the second most common joint involved with arthritis in the hand, next to the fingertips, the joint just proximal to the nail. But this is one it can be very debilitating. I mean, the patients usually will notice first pain with trying to open jars, and they have pain with that, but it progresses, and it affects pinch strength, grip strength. But as you can imagine, there's not much in life that you don't do when you're without using your thumbs.
Absolutely.
And so that basilar joint arthritis is common. There's to a degree a genetic predisposition to it, but you can have post-traumatic findings with that. It's a bit more common in women than men, but we see it in both. But it's a significant. It causes significant morbidity for people in their lives.
Okay, and can you discuss some treatments? Do you do conservative, surgical, a combination of both?
Yeah, so conservative management of CMC arthritis is predominantly anti-inflammatories, non-steroidal anti-inflammatories, either oral, Advil, Aleve, or some prescription equivalent. There's topical modalities you can use. We splint them. And we consider occasional cortisone injections for it. They've looked at other things, other types of injections, which really have not been proven to be overly successful. There's a lot you hear about stem cell now and whatnot, and the stem cell realm has not gotten to the point where we're regrowing cartilage with that. And so, stem cells, true stem cells, are government sanctioned, and you can't get a hold of them unless you're a research facility. A lot of the stem cells that are being used in the public today are a combination of maybe some stem cells and then other cells that are also involved with that. There can be some improvement in some of the symptoms, but it's just symptom improvement. They're not regrowing cartilage. And so I always caution people about that.
Absolutely.
It is not the panacea that's being espoused out there right now. I do think, though, it does hold promise that the research will get there, and we'll be able to treat a lot of orthopedic modalities with that in the future. We're just not there yet.
So talk a little bit about surgery as well, and then we'll kind of tie Laura into the after surgery. But just explain briefly what you do in surgery. Is it a plate, a screw, a combination of both?
Yeah, so there are different ways that you can address that arthritis surgically. The biggest question that I get asked is, when should I do this?
Right.
Okay, and so it's a joint replacement. So it's like any other joint replacement. If you're replacing your shoulder or your hip or your knee, you can do it at any point. And so my guidance to my patients is that I say, look, when it gets to the point where what we're doing, your arthritis is keeping you from doing the things you want to do, the things you need to do in your life, then I think about getting it done.
Absolutely.
And so the way I personally take care of CMC arthritis and my surgical technique is that there's a bone at the base of the thumb that is involved with that arthritic process. It's called the trapezium.
Okay.
I remove that bone completely.
Okay.
And then I also transfer a tendon, so I release a tendon from the form. A tendon is a structure that attaches muscle to bone. So I release that tendon from its muscle attachment, maintain its bony attachment, but use that tendon to stabilize the thumb in the absence of that bone that I remove. And that's the key. You can remove the bone, and that provides pain relief, but if you don't have stability to the thumb, then that can lead to long-term problems, several years down the road. So I want a procedure that will provide lifelong lasting effects for my patients. And this is a procedure that was first described back in 1985. It's been around for over 30 years. It has changed a little bit throughout the years, predominantly in the 90s, but the principle has stayed the same. And it's a reproducible surgery. It's a common one that we perform here, and patients typically have really good outcomes with that.
Excellent. And so, Laura, I'll kind of shift to you. After surgery, our occupational therapy department, so 3 certified hand therapists here at Bone and Joint Institute, kind of take us through a little bit of the recovery and what your role is in that recovery.
Sure. So typically after surgery, we see these patients between 5 and 7 days post-operatively. They come in a bulky dressing after their surgery. We remove that. It's a lot of education in the beginning. So in the beginning, we make a custom splint or orthosis to protect that joint because, again, the success of this is all about stability. So it's not therapy that pushes range of motion or pushes strength. It's very much letting it heal, letting the thumb get stable. So for the first 4 weeks, we're keeping that thumb pretty still, making sure people get their fingers moving, their wrists moving, not getting stiff, controlling swelling, controlling pain. And then at about 4 weeks post-op, we start moving that thumb. So, and that's all about gentle motion. It's all about getting a functional thumb, functional range of motion. So oftentimes I tell people, your thumb may not look like it bends as far as the other thumb, but if you have good function and good stability, that's the ultimate goal. So 6 weeks, we kind of guide these patients along. So we're more like a coach. We see them every couple of weeks, typically. And then at 8 weeks, we teach very light strengthening. We go over joint protection and how to make that thumb last as they get back to activities of daily living. So that's typically how we progress this.
And like we said at the beginning, it all kind of ties into the comprehensive care that we are able to offer here at Bone and Joint Institute. And describe, I know you kind of touched upon it at the beginning, but touch upon exactly what a CHT or a certified hand therapist is and the benefits of that, and then we'll kind of tie in the practice after that.
Sure. So we are, in our department, occupational therapists. Physical therapists can also be certified hand therapists. So we've all been to occupational therapy school, which typically is 4 years of undergraduate and then a graduate program. And then we have to work for, I think it's 3 years now, it used to be 5, in upper extremity. So you have to get so many thousands of hours of just upper extremity experience, and then you take a specialty board examination, and that is where you get your certified hand therapy certification. And then you have to maintain that by doing a certain number of continuing education and recertifying every 5 years. So it's very specialized. We focus on treatment from the shoulder to the hand in orthopedics, and we work very, very closely with our hand surgeons. We're a team. I can't function without him for sure, knowing exactly what he did, and that's the benefit of being right down the hall is, if I have a question, I can just go ask, and it keeps us all on the same page, which helps the patient.
And Doc, kind of speak to how having occupational therapy and hand therapists in the building positively affects your practice?
Oh, I mean, I'd echo what Laura says. You know, with surgery and anything, you know, there can be things can arise. I mean, you know, you may have a little wound issue or something like that, and it's always good to have multiple eyes on it. But you know, having multiple eyes on a patient is good, but if you don't have the communication, it doesn't do anything.
Absolutely.
And so that's what we're really blessed with here is that, you know, by having all this in-house and having a good team approach to the care of our patients, we communicate.
Absolutely.
And if anything arises, you know, patients, you know, there's hypersensitivity or something, anything, any little thing around their incision or anything like that, if there are any concerns, you know, communication's the key. You're addressing anything that comes up immediately, and that's what allows you to have reliable, good long-term outcomes.
Excellent. That kind of speaks to the comprehensive care that we strive for here at Bone and Joint Institute, not only kind of in the same specialty, but also multi-specialty across all of the subspecialties here and all the physicians, the teamwork, collaboration. So, well, thank you again both for your time today at lunch. Dr. Wurth, Laura Davis, if you have any questions for either of them or want to schedule an appointment, you can give us a call at 615-790-2630, 791-2630, and again, Bone and Joint TN. So thank you again. We really appreciate it, and have a great day.
All
Thank
right.
you.
Thank you.